Hi, Ron here with the Radiologic Technologists. I'm going to share with you in this segment kind of the gross details of being an X-ray tech in a clinical setting because a lot of people want to know what's it like, what does it entail. I've already done a video on what it looks like in a hospital setting. This segment will briefly go over a clinic where, by clinic, I mean either a physician's office or maybe an outpatient imaging center, something outside of the hospital setting. So typically, in a clinic setting, you're going to come in there. These guys are usually 8 to 5. It may be a little bit earlier, maybe a little bit later, but it's not 24 hours like the hospital. So you're gonna come in, clock in, make sure you get there early. Don't come in if your shift's from 7 to 5. Don't come in at 7 and then start getting set up to work. You want to be at your station ready to go at 7 o'clock. But clock in, say hi to everybody. You don't have a shift report like you do in the hospital where you're finding out what the night shift did that's on their way home, but you do need to have a huddle. Very common word today. You have a huddle with your team, the nurses, the doctors, the clerical staff, anybody there. You have a 5 to 10 minute huddle to talk about what's going to go on for the day. Do you know of any difficult patients coming in? Is there anything specific that needs to happen? Things you need to focus on? Maybe you're watching some metrics or some survey results that patients get to tell them how satisfied they are. Maybe you need to focus on a certain thing. That's what this morning huddle's for. It's something you do right at the beginning of the day. It's very short, 5 to 10 minutes, to kind of lay out the game plan for the day, and then you move on. Next, you're going to check your daily schedule and plan for the appropriate patient volume. You'll look at your schedule. You should know exactly how many people are coming in. Now, you will have add-ons. You always have add-ons, people that are coming in at last minute. And you always have people that will show up late, which will mess up your schedule. So you've got to figure out how to manage that schedule and get patients done appropriately but quickly and move on. You're going to want to check your examination room and your control room. Now, your control room is kind of your central hub where you're based out of. Your examination room is obviously where your equipment's at, where you do your exams. You need to check that and make sure it's stocked and has all the appropriate equipment or supplies, really. Towels, washcloths, gowns, scrubs, whatever you use. If you change your patients into scrubs, you need to make sure there's plenty of clean scrubs in there and that your dirty basket is empty. Then you want to make sure you turn on your imaging equipment. If you're turning it off at night, usually that's recommended that at the end of the day you shut down your equipment. Next morning you come in and turn it on. Perform any warm-up procedures. These X-ray tubes often need to be warmed up. A couple pushes of a button to warm the tube, get it ready. It's kind of like starting your car and letting it warm up on a cold day before you go driving. So you want to turn on the imaging equipment and do warm-up procedures. Sometimes there's quality control procedures that you have to do where you'll take pictures of certain things and look at the outcome and make sure you're logging the things that you're supposed to do. And then begins the meat of the day, and that's to take each patient one at a time and treat them as if they were a family. You may feel rushed, you may have a full schedule, but it's still up to you to take your time and do the job right and treat that patient with respect. And at the end of the day, finish all your paperwork and restock your supplies. Make sure that all of your images are in the right place. It's not the end of the job to take the x-ray. You also have to close it out in the computer system and push it to somewhere that a radiologist is going to read it. Happens all the time. Somebody doesn't pay attention at the end of their day for whatever reason, and a day or two later, somebody finds an image or a series of images that's sitting on a queue somewhere that didn't get read because the tech didn't close it out and assign it to the right work list. So it's crucial that you assign it to the right work list at the end of the day. Make sure all your images have gone to the right place, and then shut down your equipment and restock your supplies. And that's kind of what an outpatient clinic looks like. Once you close down, no worries about what's happening after that. Nobody's on call. There's no night shifts. You're done for the day. That's kind of the nice part about working in a clinical. You may do twice or three times the volume of patients that a hospital does because your patients are so easy to maneuver and they can get in and out much quicker than, say, an inpatient that's in a bed that's having a difficulty walking. So a little higher volume, faster pace. But at 5 o'clock, 6 o'clock, whatever it is, when you're closed, you're done. Hospital, never done. So I hope that helps. If you have any questions, leave it in the comments. I'll be happy to answer them. Thanks for stopping by. Come visit us at theradiologictechnologist.com.